Welcome back, peers. For those of you who aren't familiar with me, my name is Kim Northington, and I'm a Master's in Science and Nursing program student at the University of Texas, Arlington. I'm specializing in nursing education. I presently work as a critical care nurse at the Department of Veteran Affairs in Hampton, Virginia, and I'm very pleased to be able to conduct this instructional module on pancreatitis. This is going to be a 10-minute overview of what this module will consist of. This module will be broken into 3 components. The first component will be regarding the pancreas. What is the pancreas? Normal function for the normal function for the pancreas, and abnormal functions that we see within the pancreatic disease process. The second portion will be regarding treatment options, treatments that we use during chronic management of the illness at home, and also acute exacerbations that may require an inpatient stay. And the third portion of this module will be living your best life with pancreatitis. The focus of this module, it's geared towards providing nurses being able to provide education to patients and their family members. After completing this learning module, students will be able to provide education to patients regarding the pancreatic disease process and treatment recommendations. So without further ado, I'd like to dive right in. This first portion of the module will be repetitious. And I designed it this way because we are educating patients and their family members. And although we can't assume that everyone doesn't have a basic knowledge of human anatomy and physiology, we should try to refresh their memory of what exactly we're talking about. So we will be discussing what exactly is the pancreas. I want students to be able to locate within the thoracic cavity where the pancreas is, and also what are the parts of the pancreas. We have the head, the neck, the body, and the tail. And just to explain, just to give a basic idea towards our the population that we are educating. Students will have the ability to examine and model the organ and conduct a discussion with patients and family members regarding the function of the pancreas. Mastery of this topic will be demonstrated by successfully completing a 5-minute interaction between patients and family members regarding exactly where the pancreas is. So it'll be teach back. Show me where the pancreas is in your body. About how big is the pancreas? Can you tell me the different, the portions of different portions of the pancreatic body? We will also be discussing normal pancreatic function. We want the students to have knowledge of what healthy pancreatic tissue does. The pancreas is responsible for 2 main functions within the body, which is exocrine and endocrine. Basically, the pancreas is responsible for metabolizing food, primarily fats, and also for providing insulin to the body. And we need to explain that to our client population, that that's what the pancreas does. Some people may very well think it's a disposable body part similar to a bladder. Oh, my pancreas is acting up, let me just get rid of it. Oh no, you need your pancreas. Then we're going to go right into abnormal pancreatic function. We want our patient population to understand what has gone wrong when we say you have pancreatitis. We're going to have, the learners are going to be evaluated looking at deviations from the norms. They need to know what are the main lab markers that we're looking for. So we're looking for elevated serum lipase and amylase, and they need to know the normal and the abnormal values so that they can teach that to the patients and the patient's family members. When they're saying, I'm looking at these lab values, like, oh, this is abnormal, this is high. Maybe I need to look at not going to KFC this week. Mastery of the topic will be mastery of a topic will be identified when students can properly teach that to patients. And patients can relay back that they understand what's normal and abnormal. Moving right along into the second portion of the module, we will be discussing treatment options. Initially, pharmacological, what type of medications we take at home to help manage pancreatitis. And honestly, there's not a lot. The main component of managing pancreatitis at home is that you are taking replacement pancreatic enzymes depending on how far along patients are along in the disease process, it's very possible that the majority of the pancreatic body could be completely destroyed and is unable to produce its own enzymes properly. So we are going to educate our patients and family members about they need to be taking their pancreatic enzymes at home, and also how they can manage minor exacerbations of pancreatitis at home using, we always start with non-opioids first, acetaminophen, ibuprofen, and then we go into maybe a mild opioid such as codeine. And hopefully nobody is really managing their pancreatitis long-term at home with actual morphine, because that's another problem in itself. We want the students to be able to vocalize a mastery of the topic. They're going to actually do a written evaluation. You're going to take a look at your patient's whole medication list, and you're going to go through it and make sure they understand how to take their medications, when to take their medications. And as always, we do use APA format. The next portion within pharmacological options, treatment options, is inpatient medications. Patients need to know that they're going to be on IV fluids to help relieve bowel rest. They're probably going to have that NG tube placed, so that even something simple as saliva can stimulate the pancreas to produce enzymes, which makes the pancreatitis inflammation much, much worse. Mastery of students' knowledge of this learning objective, it will be obtained by also doing a written evaluation of the patient's inpatient medical administration record. And then we move into holistic contemporary alternative modifications for managing pain, guided imagery, deep breathing, meditation, some people, spiritual healing. So that was big growing up in my family. We believed in faith healing. That was a very big component of my upbringing. You went to Jesus and you asked for healing before you got a Tylenol. That is how I was raised, and a lot of people, they are raised like that. We need to be cognizant of people's various beliefs, and we need to be respectful of them. If you want to pray before you take ibuprofen, go right on ahead, Mr. Johnson. Initially, other alternative methods to manage symptoms at home may be nausea and vomiting. You can use ginger, you can use mint, essential oil diffusion. Some people feel amazing after they have a fan blowing on their face. We can teach our patients to do this, and mastery of this will be you will be able to write just something, an informal, very informal, maybe 2 to 3 paragraphs about how you would instruct your patient to use non-pharmacological options to manage their pain, their discomfort. The last portion of this module will be living your best life with pancreatitis. We need to teach our patients what diet modifications they need to be using to help prevent acute exacerbations and manage their chronic illness. The low-fat diet, specifically extra water take, compliance with diet and medication interactions, and limiting consumption of alcohol. That is the biggest thing. If you cannot tell them to abstain completely from alcohol consumption, we want our patients and their family members to know that alcohol is the #1 culprit for pancreatitis exacerbations. Formal plan of care will be used as a mastery tool for evaluating the student's understanding of this component of the module. Lifestyle modifications. We need to teach our patients they need to be exercising, maintaining a healthy weight, once again, abstaining or limiting alcohol, and exercise. Exercise is a big, big component of living your best life with pancreatitis. And mastery of this topic will be obtained again through the care plan that's formally written for the patient. And I don't want you to get the idea that you're writing 3 and 4 different care plans. This is one major care plan to include all the components addressed and using APA formats. And then we will be having a 15-minute wrap-up session. Pancreatitis is a very difficult subject to discuss with people because if people don't manage it properly, it can be fatal. You can die from complications related from the pancreatitis. Once the pancreas is completely destroyed, it's lost its ability to produce insulin, and then you need to move into issues such as diabetic ketoacidosis, and you move into the renal failure component that always follows unmanaged diabetes. And there's a plethora of research out there that's suggesting that pancreatitis can cause pancreatic cancer, and we all know how fast pancreatic cancer can take a life. We'll have a question and answer discussion. We'll discuss the hard questions that our patients are going to ask us. Patients are going to ask us, can pancreatitis make me a diabetic? It's going to ask you, what's the worst thing that can happen if I don't manage my disease? Family members may ask, can I just get a new pancreas? And they may ask, can pancreatitis kill me? And we need to have knowledgeable answers, and we need to be able to deliver them in a compassionate but firm manner and focus on reiterating that this disease can be managed. Sources will be attached regarding the information I presented today, and also you can click on these links and you can also attach them to your care plan to your patients so they can look up this information for themselves. Thank you guys so much for joining me today. It has been an absolute pleasure, and I'll see you soon.